Hi guys, I'm Kelly.
And I'm Brooke.
And I'm going to be talking about the cardiovascular system as well as obesity across the lifespan.
And I'm going to do the pulmonary system with all the disorders that go along with that and also endocrine disorders.
The first disorder I'm going to talk about associated with heart disorders is coronary artery disease. Coronary artery disease, also known as CAD, primarily occurs secondary to atherosclerosis. Atherosclerosis is the narrowing of coronary arteries from the buildup of fatty deposits and plaque. It narrows blood vessels, which restricts blood flow, reducing the amount of necessary oxygen and nutrients reaching the heart. The formation of atherosis plaque is a complex and progressive process. It may be prompted by injury, rupture, inflammatory, infectious response, or a structural genetic predisposition. If untreated, two things can happen: myocardial ischemia, which is reduction in blood flow and tissue injury, and a myocardial infarction, which is death of heart tissue. Coronary artery disease is one of the leading causes of death in the United States, and it often goes undiagnosed until a patient is present with a heart attack. Anginas, arrhythmias, heart failure, and sudden death all contribute to angina. Peripheral artery disease also plays a role. Signs and symptoms of CAD include chest pain, nausea, vomiting, diaphoresis, which includes excessive sweating, fatigue, pallor, cool extremities, and shortness of breath. Treatment includes medications such as beta blockers, calcium channel ion blockers, nitrates, and surgical interventions, risk factor modifications, and exercise. Surgical interventions include coronary artery bypass graft, erythrectomy, or percutaneous transluminal coronary angioplasty with a balloon or stent placement. Angina. More than 6 million Americans are estimated to have angina, with a 20 to 25% of men prevalence and a 14 to 25% of women older than 65 prevalence. This disorder is caused by the narrowing of coronary arteries, which cause chest pain. Pain is described as pressure, tightness, or squeezing in the chest. It can be felt in the jaw, neck, and left arm. Two types of angina exist. Stable angina, which is the most common, usually resolves after a few minutes of rest or with medication such as nitroglycerin. Typically occurs under the same circumstances and with the same level of activity or exercise. Unstable angina has no pattern and is not triggered by any particular activity. It's usually caused by a rupture of plaque with thrombus formation that occludes one of the coronary arteries. It does not resolve with rest or medications and requires emergency treatment because it may indicate a heart attack. Stable and unstable angina contribute to atherosclerosis. A third type of angina, different than the first two, is principals or variant angina. This is when chest pain is experienced at rest and caused by an occlusion of the blood vessel by vasospasm and not atherosclerosis. This type of angina occurs in cycles. It is more common in younger women with arrhythmias or conduction deficits. This is an extremely rare disorder. Myocardial infarction, also known as a heart attack, affects more than 1 million people annually and is the leading cause of death in the United States. It results from unstable angina, reduced blood flow and oxygen to the heart, coronary artery blood vessel plaque rupture or thrombosis, reduced blood supply to the myocardium, irreversible tissue damage and necrosis, and endocardium is the most prone to damage in this disorder. Risk factors include family history, smoking, hypertension, and obesity. Additional factors include cocaine use, vasculitis, which is the inflammation of a blood vessel, aortic stenosis, aortic root, or coronary artery dissection. Symptoms include pain or no pain, a crushing sensation in the chest, jaw, or down the left arm, nausea or vomiting, fatigue, shortness of breath, perspiration, cool or clammy skin, anxiety, or restlessness. A woman may experience early warning symptoms for a few weeks prior to the MI occurring of unusual fatigue, shortness of breath, anxiety, and sleep disturbances. An MI may be silent or asymptomatic. The location of the occlusion, the length of time of the occlusion, and the presence of collateral circulation determines the extent of the damage from the MI. Several different categories of MI exist. An acute MI, which is frequently referred to in medical records as an ST elevated MI STEMI, a non-ST elevated MI NSTEMI. ST reverses the segment of an EKG that reflects ventricular repolarization. usually signifies more profound tissue damage because it implies full thickness necrosis. End-STEMI non-transmural MI is limited to 1 or 2 layers of the heart, but not all 3 layers. Diagnosis for an MI may be prescribed blood tests looking for creatine kinase or Tropin's markers. Complications from an MI may result in arrhythmias, cardiogenic shock, pericarditis, clots, congestive heart failure, or sudden death. Treatment focuses on limiting damage to the heart muscle, relieving pain, preventing clot formation, and improving blood flow to the area of the injury. Reestablishing adequate circulation to coronary arteries is vital in the treatment process. Medical management includes cardiac monitoring, medication including nitroglycerin, beta blockers, angiogenesis, converting enzymes, inhibitors, aspirin, anticoagulants, supplemental oxygen therapy, or revascularization surgery. Cardiomyopathy. According to the American Heart Association, cardiomyopathies are a heterogeneous group of diseases of the myocardium associated with mechanical and/or electrical dysfunction that usually exhibit inappropriate ventricular hypertrophy or dilation and are due to a variety of causes that are frequently genetic. They can be restricted to the heart, are part of a generalized systematic disorders, which often leads to cardiovascular death or progressive heart failure-related disabilities. They can be categorized as either primary, which include genetic, mixed, or acquired, or secondary. I'm going to be discussing 3 primary cardiomyopathy disorders today. The first is dilated cardiomyopathy. This is mixed, which means it has a genetic and non-genetic component to it. In this disorder, it involves a loss of heart muscle tone, and heart chambers become dilated or enlarged. Left ventricle loses contractibility and becomes weaker, therefore decreasing cardiac output. This disorder is the third most common form of heart failure and indicative that a heart transplant is necessary. It is caused by viral or bacterial infection, hypertension, ischemic or valvular heart disease, chemotherapy, drug and alcohol toxic effects on the heart. Signs and symptoms include shortness of breath, dyspnea on exertion, orthopnea, fatigue, peripheral edema, peripheral cyanosis, weight gain, enlarged liver, jugular vein distension, dry cough at night, and tachycardia. Treatment of this disease focuses on the underlying cause of the disorder: medication, cardioversion, pacemaker, surgery, lifestyle modifications. The second primary cardiomyopathy disorder is hypertrophic cardiomyopathy. This is genetic. It involves a thickening of the left ventricle and interventricular septum. The left ventricle becomes stiffer and can't fill up during the diastolic process, which results in left ventricle volume decreasing and increased pulmonary pressure. This most commonly occurs in cardiomyopathy and is most commonly the cause of death in young people, especially athletes. It is caused by hereditary, hypertension, thyroid disease, obstructive valvular disease. Signs and symptoms include angina, syncope, dizziness, dyspnea, fatigue, heart murmur, and cardiac arrhythmias. Treatment includes medications, ablution, cardioversions, pacemaker or ICD insertion, mitral valvular repair or replacement, heart transplantation, septal myectomy, or ventricular myectomy. The third primary cardiomyopathy disorder is restrictive cardiomyopathy. Again, this one is mixed. It involves thickening and rigidity of the ventricles with decreased ventricular filling. As a result, cardiac output decreases because of decreased systolic and diastolic. It is caused by amyloidosis or sarcoidosis, hemochromatosis, which is hereditary iron overload disorder, and infiltrative neoplastic disease. Signs and symptoms include fatigue, dyspnea on exertion, orthopnea, chest pain, peripheral edema, ascites, jugular vein distension, liver engorgement, and peripheral cyanosis. Treatment includes focusing on the underlying cause, medication, and a low-sodium diet may be put in place. Another disorder of cardiomyopathy is acquired cardiomyopathy. This includes myocarditis, an inflammatory cardiomyopathy disorder. It may be caused by a virus, bacterial, fungus, parasites, toxins, or drugs. It can lead to dilated cardiomyopathy and left ventricular dysfunction. Additional forms of acquired cardiomyopathy can be caused by extreme emotional stress or occur during postpartum. Secondary cardiomyopathies are systemic diseases with myocardial involvement that are not necessarily confined to the heart muscle. This is ventricular diseases, storage diseases, endomyocardial fibrosis, endocrine disorders, nutritional deficiencies, electrolyte imbalances, autoimmune or collagen disorders, neurological or neuromuscular disorders, drug or heavy metal toxicity, and cancer treatments. Inflammatory disease. There are 3 inflammatory diseases. Endocarditis, which is an infection in the endocardium and heart valves caused by bacteria entering the heart through the bloodstream. Bacteria may enter through a dental procedure, urinary tract infection, or through IV drug use. Symptoms include fever, fatigue, dyspnea, weight loss, night sweats, joint pain, and numbness of upper extremity and lower extremities. Treatments include antibiotics, bed rest, fluids, and surgery. The second disorder, myocarditis, is an inflammation of the myocardium or heart muscle secondary to viral, bacterial, parasitic, or fungal infection. It is associated with immunosuppressant drug therapy such as chemotherapy, allergic reactions, exposures to certain chemicals, and systemic diseases. Symptoms include dyspnea, orthopnea, fatigue, chest pain, cardiac arrhythmias, fluid retentions, and fever. If it is bacterial, it will be treated with antibiotics, and if it is viral, it will be treated with steroid diuretics. The third inflammatory disease is pericarditis. This is an inflammation of the pericarditis. It is often associated with myocarditis. It may lead to cardiac tamponade and heart failure. It can be secondary to heart attack, open heart surgery, immunological conditions, uremia, kidney failures, or infections. Symptoms include chest pain, dry cough, and fatigue, fever. Treatments include non-steroidal anti-inflammatory drugs, steroids, antibiotics, pericarditis, or surgery. Valvular heart disease. This is a valve disorder or malfunction. It is caused by endocarditis, rheumatic fever, congenital heart disease, cardiomyopathy, aortic root dilation, or atherosclerotic heart disease. There are 3 categories of valvular heart disease. Stenosis, in which the valves do not open properly and confine blood flow. Regurgitation or insufficiency, in which the valves do not close properly, allowing backwards blood flow. Prolapse, which affects the cusp of the mitral valve and the valve leaflets do not close properly. Treatment for all 3 disorders include medication, surgical repair of the valve, or replacement of the valve if necessary. Aortic aneurysms. This is the weakening and bulging of a segment of the aorta and can occur at any point along the aorta's path. An aortic aneurysm can lead to aortic dissection or rupture. It can cause bleeding, compromise vital functions, strokes, and even death can occur. Symptoms include syncope, radiating severe chest pain, or back pain. Risk factors include hereditary, atherosclerosis, hypertension, and Marfan syndrome. Treatments include surgical interventions if the aneurysm enlarges quickly or if the risk of rupture outweighs the risk of undergoing surgery. Arrhythmias. This is a change in rate, rhythm, or regularity due to a conduction disturbance of the heart, or a malfunction of the heart electrical system. It can be categorized by where the problem originates, either in the atrium, ventricle, or AV node junction, and the rate, which can be normal, fast, slow, or the regularity. The heart's rhythm pattern can be classified as regular, irregular, regularly irregular, or irregularly irregular. Normal resting heart rate is in 60 to 100 beats per minute. Bradycardic is when somebody has a heart rate below 60 beats per minute. Tachycardic is when somebody has a heart rate greater than 100 beats per minute. These 2 conditions are dangerous because the heart beats too slowly or too quickly to meet the body's blood and oxygen demands. There are several types of arrhythmias. Fibrillation is the uncoordinated, extremely rapid, and irregular contraction of the atria or ventricles. Atrial fibrillation is one of the most common arrhythmias with more than 2 million Americans diagnosed. Rates can be as high as 350 to 600 beats per minute. Treatments include antiarrhythmic drugs, or the heart can be shocked back into a normal rhythm. Atrial flutter is another type of rapid and irregular heart rate that originates in the atria and has a distinct sawtooth wave pattern on an EKG. Rates are usually between 250 to 350 beats per minute. Treatment consists of atrial pacing at a rapid rate, KnovioVision, or medications. Both may be a result of cardiac surgery or a heart attack. Arrhythmias can be caused by drug toxicity, electrolyte imbalances, underlying heart disease, hypertension, acid-base imbalances, congenital defects, connective tissue disorders, or emotional stress. Stimulants such as caffeine, nicotine, cocaine, amphetamine, or psychotropic drugs can also contribute to arrhythmias. Some arrhythmias are asymptomatic, while others have serious symptoms that can lead to death. Symptoms for bradycardic include fatigue, dizziness, syncope, or presyncope. People with tachycardic may experience palpitations, shortness of breath, chest pain, dizziness, and syncope. Treatment focuses on the underlying problem: medication, supplemental oxygen, ablation, pacemaker insertion, and plantar cardioverter defibrillator implantation, or KnovioVision. Heart failure and congestive heart failure. Approximately 5 million Americans and 15 million people worldwide currently suffer from congestive heart failure. Congestive heart failure is a progressive disease that slowly worsens over time. 1 out of 10 seniors are diagnosed with heart failure. Symptoms can be confused with changes associated with aging. Heart failure is one of the most common Medicare diagnosis-related groups, with the most medical dollars being spent on diagnosis and treatment. In congestive heart failure, the heart is weakened and unable to pump a sufficient amount of blood to meet the body's metabolic needs. The heart chambers enlarge, resulting in less efficient at pumping blood out, causing a backup of blood into the venous system, overloading the tissue, resulting in edema. Hypertension, damage of heart tissue from MIs, valvular disease, cardiomyopathy, or congenital heart defects all contribute to heart failure. Other risk factors include emotional stress, obesity, thyroid disorders, diabetes mellitus, pulmonary diseases, renal diseases, fever infection, anemia, drug toxicity, certain medication, or sedentary lifestyle. Symptoms include dyspnea, orthopnea, fatigue, exercise intolerance, coughing, hepatology, which is the abnormal enlargement of the liver, weight gain, and lower extremity edema from fluid retention. Heart failure can be categorized by right-sided or left-sided, also systolic and diastolic. In right-sided heart failure, the right ventricle cannot contract properly, resulting in blood backing up into the peripheral circulation. Symptoms include dyspnea, orthopnea, paroxysmal nocturnal dyspnea, jugular vein distension, cardiac cirrhosis, cyanotic nail beds, hepatology, ascites, jaundice, right upper quadrant pain, fatigue, anorexia, nausea, weight gain, decreased urinary output, edema in feet, and psychological disturbances. In left-sided heart failure, it is the most common form of heart failure in the U.S. The left ventricle cannot contract normally and blood backs up into the lungs, resulting in cardiac output reduction. Symptoms include progressive dyspnea, orthopnea, paroxysmal nocturnal dyspnea, cough, pulmonary edema, tachypnea, diaphoresis, enlarged heart, cerebral hypoxia, anxiety, sleep disturbances, fatigue, exercise intolerance, muscular weakness, tachycardia, hepatimesis, and pallor. Whatever classification is used to classify heart failures, the prognosis is poor. There is a 50% mortality rate annually for people in advanced stages of this disease. Medical management focuses on treating underlying causes, medication, and lifestyle modifications. Congestive heart medications include ACE inhibitors, beta blockers, digitalis, diuretics, and vasodilators. Surgical interventions for congestive heart failure include revascularization, angioplasties, ventricular assistive devices, or heart transplant. The main goal is to slow the progression of the disease in most patients. There are a wide variety of surgical interventions to treat these heart disorders. The main ones are coronary artery bypass graft, angioplasty, pacemakers and implantable defibrillator devices, off-pump coronary artery bypass and endoscopic atraumatic coronary artery bypass, ablation, KnovioVision, and circulatory assistive devices. Vascular disorders. I will not be going over hypertension or hypotension since we already learned about it this year, but if you would like, there's more information in the book to learn about. I touched on atherosclerosis while talking about coronary artery disease, but it is the most common and serious vascular disease. It affects the heart, kidney, brain, other vital organs, and extremities. Peripheral vascular disease. 60,000 patients are admitted to the hospital with PVD each year, averaging a hospital stay of 11 days. This is associated with significant morbidity and mortality, increased prevalence with age, and increased risk for cardiovascular disease, coronary artery disease, and aneurysm. 50% are asymptomatic and 25% undergo treatment. Modifiable risk factors include diabetes, smoking, hypertension, and hypercholesteremia. Non-modifiable include age, gender, and family history. Peripheral artery disease is caused by a lack of blood supply, usually in the lower extremity, as a result of stenosis or occlusion within the arteries. Symptoms include cold extremities, occasional numbness, absence of hair, painful ulcer on pressure points, and claudication. Diagnosis may be done through various imaging testments, while treatment focuses on medication, surgical interventions, and modifications of risk factors. Venous stasis occurs when blood flow is static or altered in the lower extremity. Lack of calf muscle contraction and decreased blood flow results in thrombosis in the immobile patient. Loss of vein function or loss of blood flow may occur as a result of trauma or injury to the veins. It can be prolonged and cause venous stasis ulcers to develop. There are two types: superficial phlebitis and deep vein thrombosis. Treatment includes rest, elevation of lower extremity higher than the heart, and wearing compression stockings. Venous thrombolism. Stasis, endothelial injury, and hypercoagulability of blood contribute to thrombosis. Thrombosis is made up of fibrin, red, and white blood cells and platelets. Risk factors include prolonged immunization, surgery, trauma, cerebrovascular accidents, fractures of the long bone of the pelvis, spinal cord injuries, smoking, older than 40 years old, malignancy, heart failure, previous vein thrombosis, obesity, pregnancy and contraceptives, anesthesia, chemotherapy, varicose veins, inflammatory bowel disorder, renal failure, central venous catheterizations, and chronic obstructive pulmonary diseases. Deep vein thrombosis, or DVTs, affect 2 million people each year. Pulmonary embolism is also present in 30 to 50% of this population. It can occur in deep veins of the legs, arms, or pelvis. It may occur from injured veins. 50% of people are asymptomatic. The other 50% include swelling, pain, tenderness, and warmth of affected area, cause asymmetric calf edema, fever, and pain with dorsiflexion of the foot. Treatment for patients who are positive for DVTs includes anticoagulation therapy. Patients with massive DVTs may undergo surgery. Superficial thrombophlebitis is a sudden inflammation and blood clots that adhere to superficial vein walls. It may form in the arms, legs, or groins. Symptoms include pain, swelling of affected area, redness of skin over the vein, warm, tenderness, and feeling of a hard cord under the skin. Treatment includes warm, moist compresses, medication for pain and inflammation, antibiotics, and support stockings to prevent reoccurrence. Surgery may also be possible. Pulmonary embolism. This is estimated to occur 600,000 times annually in the United States and contribute between 100,000 to 200,000 deaths. It is often undersuspected or misdiagnosed. It is caused by a DVT that breaks loose, known as an embolus, and flows through the venous system towards the pulmonary circulation. The embolus lodges in the lungs and prevents blood flow from the right side of the heart to the lungs. This can be fatal. 2/3 of patients are asymptomatic. Symptoms include sudden dyspnea, tachycardia, tachypnea, chest pain, syncope, cyanosis, sweats, and low-grade fever. Treatment includes IV heparin, IVC filters, thrombolytic agents, and pulmonary artery embolectomy. Switching roles, we're going to talk about obesity across the lifespan. Childhood obesity. A child is considered obese when they are extremely overweight with a BMI equal or greater than the 95th percentile. Approximately 17% of children and adolescents 2 to 19 years old are obese. 12.7 million children and adolescents have been affected over the past decade. More than 1 in 6 children and adolescents aged 6 to 19 are considered obese. Causes include family factors, psychological factors, and socioeconomic factors. Risk factors include cardiovascular disease, CVDs, high cholesterol levels, high blood pressure, and abnormal glucose intolerance. Obesity may lead to other health problems such as heart disease, type 2 diabetes, gallbladder issues, knee and joint disorders, asthma, sleep apnea, and social discrimination. There are several childhood obesity programs taking place in the United States. Michelle Obama is a strong advocate for youth obesity. Some federal programs addressing childhood obesity is Let's Move, Healthy Schools, and We Cans. This is only several of the programs, and if you'd like to read more about them, you can refer to these slides or the internet. Adult obesity. Although childhood obesity has started to level off, adult obesity continues to rise. An adult is considered obese when they have a greater than 30 on the BMI scales. Prevalence for both gender is about the same, 36%. More than 1/3 of adults are considered to be overweight or obese, resulting in 78.6 million people affected. 1 in 20 adults are considered to be extremely obese. Related conditions include heart disease, stroke, type 2 diabetes, sleep apnea, and certain types of cancer. Some health consequences include mortality, hypertension, type 2 diabetes, coronary heart disease, gallbladder, osteoarthritis, mental illness, etc.
So now we'll be discussing pulmonary disorders. So the first pulmonary disorder we're going to be talking about is chronic obstructive pulmonary disease, which is known as COPD. It is a gradually progressive disorder chiefly defined by chronic airflow limitation that is not fully reversible. It's the 4th leading cause of death in the United States and affects 16 million adults. Some common causes are long history of tobacco use, history of exposure to dust or chemicals, the environmental exposure, and genetic predisposition. Then some comorbidities are heart disease, osteoporosis, diabetes, lung infection, anxiety, and cognitive decline. So some interventions for COPD are the treatment focuses on symptom management, the prevention of exacerbations, and slowing the disease progression. And then there are medications used which are used to open the airways, reduce inflammation, and break up secretions. Oxygen therapy is also used, and exercise is also an important component, and surgical is through the lung volume reduction surgery and bulectomy and lung transplantation for end-stage disease, and then the non-surgical are pulmonary rehabilitation programs. So the interprofessional team members are occupational therapists, pulmonologists, pharmacists, nurses, social workers, clinical psychologists and psychiatrists, and the dietitians. And the occupations that it affects is people's regular ADLs, IADLs, and it decreases their endurance and the limited ability to just be able to do work on a daily basis. So emphysema is a common type of COPD in which a recurrent inflammation destroys the walls of the alveoli, causing bullae, which is air sacs, and which leads to air trapping and loss of elastic recoil and hyperinflation and impaired oxygen exchange. The epidemiology is that more than 3 million Americans have emphysema, and it's diagnosed usually around age 40. And it says that it's more common in men, but statistics are now saying that it's more common in women because they're increasing the amount of times they smoke and stuff like that. And the mortality rate is, in the United States, for adults older than 35 years, is 64.3 deaths per 100,000 in the population. So some common risk factors include smoking alpha-1 antitrypsin, which is a genetic form of emphysema that results from a deficiency of the alpha-1 antitrypsin protein. Some characteristics of emphysema are dyspnea or exertion and malnutrition, weight loss, muscle wasting, clubbing of the digits, decreased chest expansion, wheezing, and rapid shallow breathing. And the systems affected are the lungs, especially the alveolar sacs. And the comorbidities, they're the same as COPD, besides the fact that cancer and cerebrovascular disease is also common. And the intervention is the same as COPD, so just look back at that slide. And the interprofessional team is occupational therapists, primary care provider, pulmonologists, pharmacists, and respiratory therapists, and nurses. And the types of setting are usually hospitals and long-term and acute care settings. So chronic bronchitis is one of the most common forms of COPD. It is characterized by airway resistance because of inflammation and edema with impaired mucocellular clearance. It's defined as a chronic productive cough that lasts for more than 3 months in a year during 2 consecutive years that is not caused by another respiratory disorder. The epidemiology is 49% of smokers develop chronic bronchitis and 24% develop emphysema, and the symptoms affected are the lungs. So some common characteristics are excess mucus production, prolonged expiration, periods of exasperation that results in lung function deterioration, also bluish lips and skin as a result of poor oxygen, and the lining of the bronchioles are inflamed, swollen, and narrowed from long-term lung irritation. Some risk factors are the same as COPD and emphysema, but the you have recurrent respiratory tract infections, and then some comorbidities are the same as COPD. So go back to those slides again. But mucus is trapped with which obstructs the airways and increases the risk of bacterial infection. Smaller airways collapse with the development of hypoxemia, hypoventilation, and eventual right side heart failure and hypertension. Intervention is the same as COPD and emphysema, and the interprofessional team is the same as others. And then the occupations are ADLs and IADLs, and it affects their endurance. And the settings are hospitals and acute care settings. So bronchiolitis is under the umbrella term for COPD. It is an inflammatory disorder that affects the bronchioles and may be present even in young and healthy smokers. Some risk factors are HIV, environmental toxins, drugs and medications, and organ transplantation. Symptoms include flu-like symptoms, fatigue, dyspnea, and then bronchospasm and weight loss. And some treatments are steroids, nutritional support, exercise, oxygen therapy, emotional support, and airway clearance techniques. Asthma is a reversible or reactive airway disease affecting approximately 14 to 15 million people in the United States. 7.2% of all the world's population, and higher incidence in females. The etiology is unknown, and incidence of childhood asthma, maternal smoking, secondhand smoke, heredity, gender, occupational or environmental exposures, and usually caused by allergies. And some characteristics are wheezing, coughing, shortness of breath with activity, and scratchy whistle sound when you're breathing. So some possible comorbidities for asthma are rhinosinusitis, gastroesophageal reflux disease, mental illness, and chronic infections and obstructive sleep apnea. Some interventions are oxygen therapy, and they also use medications such as corticosteroids and a combination inhalers. They also want you to do lifestyle modifications such as just recognizing and avoiding of the triggers that will affect your asthma, and just having education, training, and stuff like that. And it is important to breathe through your nose and to humidify the air, and taking prescribed medication 20 to 30 minutes before you know you're going to exercise or do some sort of activity, and nutritional counseling for the use of corticosteroid medication. And then interprofessional teams are your doctor, your nurse, exercise physiologist, dietitians, and clinical psychologists. So bronchiectasis is an abnormal dilation of the bronchi resulting in bronchial wall thickening, inflammation, and airway obstruction. It may be caused by damage to the respiratory system from infection, severe PNA, aspiration of foreign objects, or gastric contents, genetics, and also immunodeficiencies. It's marked by purulent sputum, cough, hemoptysis, shortness of breath, and decreased exercise tolerance. And the treatment is aimed at slowing the progression of the lung disease, symptom management, and then treating the underlying causes, and the medications. You can use medications and also oxygen therapy. So atelectasis is a partial or complete collapse of the lung, usually caused by lung compression or an obstruction of a bronchus. Its potential causes may include prolonged bed rest, heavy sedation, obesity, smoking, lung compression by fluid or air in the pleural space, or foreign objects obstructing the airway. Symptoms include shortness of breath, tachypnea, and shallow respirations. Some treatment is removing any obstructions and ensuring the airways remain open. So deep breathing with intensive spirometry and supplemental oxygen, and also functional mobilization and bronchopulmonary hygiene. So idiopathic pulmonary fibrosis is a progressive lung disease of unknown etiology. It has poor prognosis and no cure. So the life expectancy after diagnosis is approximately 3 to 4 years. So inflammation may be a contributing factor because the lungs become fibrotic, scarred, and stiff, making it difficult for people to breathe. And it's associated with history of extensive smoking. And some of the symptoms include chest pain, cyanosis, cough, severe dyspnea, pulmonary hypertension, clubbed fingers, and toes. And treatment includes supplemental oxygen. So the response to conservative treatment is typically poor for those with this disease because it generally includes use of supplemental oxygen and medication, and lung transplantation is also an often indicated thing. So pneumonia is an inflammation of the lung tissue. It's the 7th leading cause of death in the United States. Approximately 50,000 people have died, and it affects about 1 out of 100 people, so 2 million people each year in the United States. So it affects the lungs, especially the air sacs, and because the air sacs become inflamed and fill up with fluid, and also oxygen may have trouble reaching your blood. Its characteristics are cough, fever, shaking, chills, and shortness of breath, sharp pain in the chest, loss of appetite, low energy, and confusion, especially in older individuals. Some risk factors are history of smoking, compromised immune system, history of chronic lung disease, and honestly your age, so if you're older and young people are at risk. So some comorbidities are people age 65 or older, kidney, heart, or lung disease, diabetes, cancer, or a depressed immune system. The intervention is you need to have a lot of rest, use antibiotics, oxygen therapy, have a lot of fluids, and in some cases, mechanical ventilation. And the interprofessional team are occupational therapists, a doctor, nurse, and a pharmacist. And usually the type of settings are hospitals and acute care settings. So pulmonary edema is a common condition which is buildup of fluid in the extravascular spaces of the lungs, resulting from changes in hydrostatic pressure, forcing fluid into the alveoli. It's more than 20,000 cases in the U.S. per year and occurs in adults that are 41 years and older. It's caused by heart conditions, and other causes include pneumonia, exposure to certain toxins and drugs, and high elevations. So there are 2 categories. Cardiogenic pulmonary edema, which is an increase in the transmural pressure associated with cardiovascular disorders such as myocardial infarction, left-sided heart failure, cardiomyopathy, mitral or aortic valve disorders, or hypertension. And then there's non-cardiogenic pulmonary edemas, which results from an increase in the alveolar capillary membrane permeability, resulting in alveolar flooding, and is associated with ADRS. Associated with impairment in the lymphatic system, capillary injury, and damage to the lungs through poisoning. And some symptoms are dyspnea, cough, orthopnea, tachypnea, tachycardia, hypotension, cardiac arrhythmias. And the treatments are usually medications and supplemental oxygen. So pulmonary hypertension is really rare. It's fewer than 200,000 cases per year, and it affects newborns from birth to the age of 2, but it also affects those who are 40 years and older, and usually is more common in females. If untreated, it leads to heart failure with an average survival rate of 2.8 years from the time of diagnosis. It's a progressive disease characterized by an elevation in pulmonary artery pressure, often associated with heart, vascular, or lung parenchymal disease. The right side of the heart has to work harder, leading to the right ventricle to hypertrophy, and weakens, eventually leading to complete heart failure. And some risk factors are family history, obesity, obstructive sleep apnea, gender, pregnancy, altitude, congenital heart disease, lung disease, liver disease, and connective tissue disorders, and also drugs and toxins. So some comorbidities are congenital heart disease, HIV, liver disease, lupus, sickle cell disease, and methamphetamine use and sleep apnea. And some treatments, they focus on symptom management and improving quality of life. Some symptoms are dyspnea, lower extremity edema, heart palpitations, cyanosis, and fatigue. And the treatment aims are like reducing work of the right ventricle and the lungs, and using supplemental oxygen, anticoagulation diuretics for edema, vasodilators, and they want to focus on lifestyle modifications such as changing your exercise and diet. And some surgical procedures, you can have atrial septostomy, and lung transplantation. Interprofessional team is OTs, cardiologists, pulmonologists, critical care doctors, and primary care providers. So for the next few slides, I'm not going to go too in-depth, and since Kelly already mentioned pulmonary embolism, so I would just go back to her slides to refer to what she said. So pneumothorax is when air gets between the lungs and chest wall, causing a change in the intrapleural pressure within the chest cavity, and it can cause lungs to collapse and can be caused by a trauma such as a gunshot or a stab wound. So hemothorax occurs when bleeding occurs in the pleural cavity, and treatment focuses on determining the source of bleeding. So pleural effusion is buildup of fluid within the pleural space, and it results from a variety of conditions related to lungs or other organs, including lung cancer, chest trauma, sarcoidosis, tuberculosis, and congestive heart failure. So apemia is the collection of pus caused by an infection found within the pleural cavity, and is often associated with bacterial PNA, and also caused by bacteria entering the pleural space from trauma, surgery, or aspiration, PNA. Pectus excavatum is a congenital and possibly genetic chest wall deformity in which the interior chest has sunken in or have a concave appearance. It may compromise cardiac function and lung function, or both, and is treated surgically for all but mild cases. So tuberculosis. The incidence of active TB was 4.4 cases per 100,000 people, with 2 billion cases of active and latent TB worldwide. It manifests as an active disease, or it can be latent where it lays dormant for many years but is reactivated when the immune system weakens. So some symptoms include cough, fatigue, weight loss, night sweats, and hemoptysis. And some possible comorbidities are HIV, diabetes, malnutrition, tobacco smoking, and harmful use of alcohol. The treatments usually are just antibiotics and chemotherapy, and bed rest is very important. So sarcoidosis is a systemic inflammatory disease of unknown etiology that can affect almost any organ in the body. It can manifest as a skin lesion or as musculoskeletal or liver disorders. It predominantly affects the lungs, and some symptoms include fever, cough, dyspnea, fatigue, glaucoma, and weight loss. So obstructive sleep apnea is marked by recurrent periods of breathing cessation for at least 10 seconds, resulting in sleep fragmentation, hypoxia, and hypercapnia. It may lead to cardiovascular disease. And some risk factors are gender, obesity, nasal problems, and hypertension. So lung cancer is responsible for approximately 1.2 million deaths worldwide, making it the most common cause of death from cancer. And it's a 15% survival rate of 5 years in the U.S. I'm not going to talk that much about this since we have heard a lot about lung cancer. So just if you want to know more information, just read up upon these slides. So now we're going to touch base upon endocrine disorders such as diabetes and hyperthyroidism and hypothyroidism. So diabetes insipidus is a rare condition. It's a prevalence of 3 cases per 100,000 in the population, so very rare, and it's caused by a lack of response to ADH. There are 2 types, which are central diabetes insipidus, which is ADH is lacking or is produced at insufficient levels and results in excessive thirst and urine production. Then there's nephrogenic diabetes insipidus, which results of kidney disease that makes the kidneys unable to respond to ADH in the system, and it can't conserve water, so symptoms are the same as the one above, and the treatment is anti-inflammatory medication and diuretics. So now I'm going to talk about diabetes mellitus, which is type 1 and type 2. It is a disease in which glucose is insufficiently metabolized. So abnormal glucose metabolism results in high glucose levels in the blood and urine because of an absolute lack of insulin or lack of insulin action to lower the blood sugars. The prevalence is type 2 is more common than type 1, and there's more than 3 million cases per year in the U.S., and it remains the 7th leading cause of death in the United States. So type 1 diabetes is usually known as juvenile diabetes. It results of an absolute deficiency of insulin secretion, and it accounts for 5 to 10% of all diagnosed cases. Symptoms include increased thirst, frequent urination, hunger, fatigue, and blurred vision. And so treatment aims, you're going to use the medication and you're going to use insulin and inject insulin. So type 2 diabetes results when the body is resistant to the effect of insulin, and it accounts for 90 to 95% of all cases, and obesity is the most important risk factor. It is referred to non-insulin dependent diabetes. So some symptoms are fatigue, weight loss with overeating, and emotional liability, irritability, and strongly associated with hypertension and heart disease. Some treatment is balanced diet, weight control, exercise, and then some different types of medications, and if it's severe, you have to treat with insulin. So hypothyroidism is a failure of the thyroid gland to secrete the hormone TH. Some symptoms include fatigue, cold intolerance, constipation, forgetfulness, and weight gain. Some common characteristics is with someone with hypothyroidism is they have a goiter, which is an enlarged thyroid. So hyperthyroidism can result from excessive amounts of the thyroid hormone being produced, and it results in anxiety, irritability, tremors, weight loss, abnormal protrusion of the eyes, which is the most common characteristic of hyperthyroidism, also tachycardia, low tolerance for heat, and accelerated loss of calcium. And treatment is with medications, so antithyroid agents.
And these are our references. Sorry our presentation was so long,
Yeah,
but we
we're
hope
really
you
sorry.
learned a lot. Thanks.